I often hear parents say, my child snores, but it's no big deal. But the truth is that snoring in children is not normal. It can mean that your child's having trouble getting full breaths in while they're sleeping. Mouth breathing, nasal congestion, large tonsils, or even jaw development can all affect airflow. So if you find that your child's snoring, then you want to look into that because interrupted sleep can affect behavior, focus, growth, and the way your face and jaw grow. If you notice your child's been snoring, then it's probably important to get some kind of early airway assessment.